So P7.6, nuclear radiation in medicine. And the first thing we're going to look at is one called gamma cameras, okay? And they're to do with detection. And the key thing there is that you must give somebody a radioactive isotope, normally through an injection. So inject radioactive isotope, and then what will happen is that that isotope will go to the organ that you need it to, so it'll be absorbed by the organ you want to investigate. So if it's the kidneys, then the kidneys; if it's the liver, then the liver. Okay, and then what will happen is the camera detects the emissions. Okay, so then, and if you know that it's coming from inside that organ, which means you can get a very, very good picture about where the blood flow is going in that organ, how much, how fast, all sorts of information about the organ that will help you to treat the patient. And there's a couple of things that you must do when it comes to which isotope you pick. You want one that's got a long enough half-life to do the job, so that you've got time to actually record your images. But short enough to not cause damage, not cause excess damage to the body. Okay. So it's a balancing act. The longer the half-life, the longer you can take pictures for with the gamma camera, but the more damage it will do. Okay, and secondly, it needs to be a gamma emitter. It must be a gamma emitter, and the reason why it must be a gamma emitter is so that it can get out of the body. And if you think about it, alpha and beta would simply be absorbed by the internal tissue, which wouldn't be good. Okay, so that's the first use, gamma camera. Inject somebody, the radioactive tracer goes to the part of the body that you need it to go to. You can then tell how fast it got there by the rate of emission. You can tell how fast it's being absorbed into the organ. It will emit, so it will give you an idea of the 3D structure of that body. It can tell you all sorts of information. Okay, next one I want to talk to you about is the other main type is gamma radiation, sometimes beta, which is used in radiotherapy, and that's used to kill cancers. Okay. Kill tumours. Now, the way this works is, and the analogy I always like to give is of a castle being attacked. You've got a castle that's been attacked, and it's got a few roads leading to that castle. But obviously, there's people looking to see who's coming, and it takes 1,000 soldiers to storm this castle. Okay, but if you send more than 300 down any road, then the lookout will see it and the bridge will get destroyed. Okay, so you won't be able to get to the castle because the lookout will go out and he will destroy destroy the bridge that is around this castle if you send more than 300 people down any one road. So the way to do it is you send 250 down this road, 250 down this road, 250 down this road, and 250 soldiers down this road, and they all meet at the castle. Okay, and that way they can then all attack the castle at once, and the castle falls. That is exactly how radiotherapy works, where they have a gamma source, and it will be outside of the body, hence why it needs to be a gamma source. And that gamma source will be being fired from lots of different angles. So each part of the body, the only part which gets the full 1,000 soldiers is the bit where the tumour is. Every other part of the body only gets a very small percentage of the total amount of radiation, and that way they can target the cancerous cell very specifically without damaging the rest of the body. The rest of the body gets damaged a little, but they were getting really good at getting really precise at that. Now that's one of the areas where there's been massive improvements in medicine over the last 5 years. Most of it. So when it comes to radioactivity in medicine, you need to be aware of tracers, gamma cameras, radiotherapy, and similar. The other type of radiotherapy is if you have an implant that's surgically attached to the tumour or next to it, and that one can be a beta emitter because it doesn't have to get through as much stuff. It's a lot closer to the tumour, so if it is physically possible to put an implant in there, that can have an advantage because you can have a shorter half-life. It doesn't go to as many parts of the body, it only goes right next to the bit next to the tumour, so you do less damage to the rest of the body if it's possible to put an implant in which emits beta radiation, and that also works.